All right, good evening, everyone. How are you? Happy new month and welcome to ATP Live Monday. This is our first live for for February 2026. So thank you so much for joining us, whichever platform you're joining today. I am Bimi Salaboide. I'm a pediatrician, and I'm here today to answer any questions you may have about the health of your children. So, thank you so much for joining me. I can see those of you joining on Instagram, Bookie, and Just Comfort and Hilary Deborah Dimputi, welcome. And for those who are joining on Facebook as well. So I'm just going to first of all, as our custom is, share the video so that everybody can see us and everybody can know uh, we are live now. Just give me um, a couple of minutes to do that. And then after that, we'll start answering your questions. But if you have any question, feel free to start dropping your questions and I'll answer them. But first and foremost, I'm going to just share the video so that we all can see, we all can hear. So welcome. Please also share the video to platforms. And I'll answer that. Okay, sorry, my phone. Please share the videos to platforms where you have the capacity to share, so that we can all start from the beginning. Thank you so much. Good evening, Esosa Celestina. You're welcome. Thank you so much for joining. I'm also going to share and share. Let's share the videos. I'm going to continue, apart from answering questions, I'm going to also continue with the survival strategies I've been talking about. And today I'm actually going to talk all day about immunization because I've seen so many posts about immunization. I put up a post last week, a lot of responses on that post, and I feel like I will see address those issues today as we are answering your questions. We'll be addressing them as well. Okay, and then we need to pin them in the groups. Just a minute. Pin to features. So I'm just sharing and pinning. Just give me a couple of minutes to do all that. Okay, and then let's see. Okay, and let me also pin it on our page. So if you are asking question directly on Facebook page, you can just drop your question directly under the video. If you're asking in the Facebook group, you have to click on the video file so that we can see your questions in my studio. Otherwise, I'm able to say. But if you are on the page, Facebook page, or you are on Instagram, or you are on YouTube, you can just drop your questions straight away and I will say that. But if you are in the groups, I will need you to click on the video and then I can start. Okay, so thank you so much. I can start now. I think I've done all the sharing, all the pinning. Let me once again welcome you all to ATP Live Monday. ATP Live Monday is brought to you by Atp Pediatricians Foundation. Atp Pediatrician Foundation is a charity registered in Nigeria, and we are fully committed to the health and the well-being of children globally, but especially in sub-Saharan Africa, including Nigeria, where a lot of our children are still dying from preventable and treatable conditions. So that is what our platform is about. So we do a lot of health education, health information online. We answer questions all week as related to the health of children. And beyond what we do on social media, we also go to the communities. We do lots of outreaches. We've been to schools, we've been to many communities, doing free medical outreaches and empowering people and communities. So all in the bid to see that no child dies from what is preventable and treatable. So ATP Live Monday is just 1 hour session where we actually answer your questions live, and also we do a lot of teachings. And I've realized that most of you like the teachings in bites. So when we started doing this, small reels of just small information, I noticed that many people are engaging more with that rather than the long video. So we're going to do more of those kind of teachings, just 1 minute, maximum 3 minutes kind of videos, so that people just get the information they need and move on. So thank you so much for joining me. Welcome everyone, Instagram, Facebook, YouTube, welcome. So I've been talking in the series on child support strategies. Today I'm just going to continue with that, but today I'm just going to major mainly on immunization. I will say a lot of immunization, but in the interim I'll start with, because I seem to have questions already on Facebook, so I will go to answer those questions, and in between I will give my talk about immunization. So Esosa is saying, what, please ma, what could be the cause of heart palpitations in a 14-year-old, to the extent that she couldn't sleep? She's just restless. We took her to the hospital, very good, and was told to do an H. pylori test and MP test. H. pylori was negative, MP was positive one. She was given omeprazole, metro, amoxicillin, malaria drug, but she's still complaining of fast heartbeat. Okay, I don't know which hospital you went to, but if I'm seeing a child who is complaining of fast heartbeat, number one, I want to measure the heart rate. So what was the heart rate? Did they tell you what the heart rate is? So we want to know whether the heart rate is really fast for her age. Number two, I want to do what we call an ECG. I can't see any ECG in all the list of tests that was done for this child. That is the single most important thing to do in somebody who is complaining of palpitation. So palpitation is a layman language for heartbeats that you can feel. Most of us, our heart is beating now, but you don't even know your heart is beating. But when you run, when you do exercise, you see your heart beat very fast. So, and that is normal. Like if you just exercise, your heart rate will pick up and you can feel it, and it will come down once you calm down. But if somebody is not exercising, she's not done anything to increase her heart rate, and her heart rate is just unnecessarily fast, we need to know why. So we want to further do an ECG. We want to know whether is it fast, what we call tachycardia, or is it abnormal in terms of even the frequency, what we call the rhythm of the heart. So you can have it just fast and there's a reason for it being fast, or you can have it very fast and it's even irregular. So it can be fast regular, it can be fast irregular, and we need to know why. So the first thing we need to do is an ECG, and that will give us a lot of information. And after that, we can investigate the reason for this palpitation. So I don't know where you are, but you need to go to an hospital that has a pediatrician and where they can do an ECG. Okay, may still need to see just a general pediatrician, or preferably if you have the capacity, you just need to see a pediatric cardiologist. That's the appropriate specialist, so they can do the heart rate, they can analyze the ECG, and then they can advise you. And heart issues is something urgent, is something serious, so we really need to know what is going on. So I don't know your location, but a general hospital or a teaching hospital with a pediatrician, or at best a pediatric cardiologist, would be the most appropriate places to go. It is not appropriate to assume also peptic ulcer due to H. pylori infection as a cause of palpitation. That's a very unusual thing, unless there's something else your doctor saw that I'm not privy to. But out of all the tests they did, for somebody who is having palpitation, I would expect them to do a minimum of an ECG, which I couldn't see there. So can we arrange for that ECG and see a pediatrician, preferably a pediatric cardiologist? Okay, you can clip that. Thank you. Let's go to the next question. Good evening, Shakura. Thank you for joining us. Piel Chi Eke. I'm trying to print your name. Okay. So you say, is sitting powder good for babies? No. Okay, that should be clipped. I think it's one of those things I need to share again. When I say clip, because I want my AI software to kind of to cut that out for me later on. All right, so teething powder is a no. I mean, that's one of the first message that everybody who comes to ATP will know. Okay, so there is no basis for using teething powder. Teething is a normal thing for babies, okay? The same way they start to control their neck, the same way they sit, the same way they walk, the same way they get bigger, that the same way they also bring out the teeth. So it's not a disease. It does not make children to be sick. So teething does not require anything. Okay, it is something that should happen normally. And some of you, and for those who have been with us long on ATP, most of them, when they realize that someday you just wake up and you will see the teeth in the mouth of the child, nothing, and the child is otherwise okay. A lot of people always assume teething will make the child to have fever, it will make them to have diarrhea, it will make them to have cough, it will make them to be sick. That is not true. Teething on its own does not cause fever, it does not cause diarrhea, it does not cause cough, it does not cause any symptoms. Teething is a normal phenomenon. It's a normal developmental milestone. It does not require medication. But I know that a lot of mothers who will swear that, oh, once their children are bringing out teeth, they will have this symptom and all that. I can tell you what is going on, why children sometimes, in quotes, appear to be sick when they're teething. It is not the teething. Children could be sick during that period for all the reasons. Now, babies start to bring out their teeth between the age of 5 to 7 months. So averagely 6 months. At that age of 6 months, a lot of things are going on at the same time. Okay? Most mothers who are exclusively breastfeeding their babies, that is the time they stop exclusive breastfeeding and they start introducing new food. And remember, breast milk is served directly from the breast, sterile, warm, best meal, best combination. But now mothers have started introducing their own food, which some people will not take time to prepare properly, or they will give it with bottle, which can be contaminated. Also, at the same time, lots of mothers consciously or unconsciously reduce the amount of breast milk they are giving their babies, and this breast milk contains lots of what we call antibodies, things that protect the babies against infection. Some even more or less stop breastfeeding because they just thank God I'm free, but really you should keep breastfeeding as much as possible. So around the age of 6 months, when babies are breaking out teeth, this is the same time that mothers are reducing breast milk. This is the same time that the antibodies that the babies receive from their mothers when they were born, from blood, also from breast milk, those antibodies start to wane off and the babies start producing their own. So again, baby at risk of infection. This is the time that babies start to sit on their own, and then so you start putting them on the floor, and this is the same time they start to reach out for things and put all sorts of things in their mouth. So you're giving them toys, they are reaching out for things, and everything they put out of their hands, they put it in their mouth. So if there is no good hygiene around that same period, babies are being exposed to more germs from their hands, from what they touch, from what they put in their mouth, from when they sit moving around. At the same time, it's the same time that mom is reducing breastfeeding because they are now introducing other food. It's the same time that some mothers are giving milk through bottles or giving cereal through bottles. Some of these bottles are not properly washed. Again, more germs being introduced to the baby. At the same time that the baby's antibodies that they receive from their mothers are waning. So at that period, babies are actually more susceptible to infections, even things like rotavirus that causes a lot of infection. That is also the peak period of rota infection, 6 to 11 months old. So there are a lot of risk factors for infection in babies around the age of 6 months. And also babies are bringing out teeth. So people say, oh, it is the teeth that is causing all this. It's not the same. The teeth is just an innocent bystander. If you pay attention and do the right thing, if you are paying attention to hygiene, you are making sure you keep breastfeeding, you are doing your complementary feeding well, paying attention to making sure you wash the plates and the cups, and you're washing your hands, you're washing the baby's hands, you're doing all that, your baby will have their teeth without any illness, without anything whatsoever. So it has nothing to do with teething, and you do not need to give teething mixture to your baby because it's not even necessary. Then the second thing, what is actually in this teething powder they are selling to you? What did they put inside? Paracetamol and Phenergan, or any of the other family of vinegar. That is what they put inside. Maybe you need to go and read what they put inside. So basically, they're giving your child something to make the child sleep or something to make them feel less pain, which are completely unnecessary. If your child has fever for any reason, give the plain paracetamol. You don't need to give so-called teething powder, okay? So that is what is in most of those teething powder, and they're very dangerous. Some children actually can react to all those phenigans they put inside. And then even the paracetamol, even those things they put inside, they put it in substandard dose. So it is not even going to give you the fever relief that you want. So if your child has fever, give paracetamol, not teething powder. And don't assume the fever is due to teething. It is not. The child could be sick. The number of children we have lost as pediatricians who are not brought to the hospital on time because mothers think, oh, it is teething. They said it is teething. And that is it. Because you see a child who is almost dying, and pediatricians, we are trying our best, but we're not God. We need you to bring the children early when they're sick, okay? Because we can only do so much. The earlier you bring the children, the better. So, but if you brought the children late, we can only try, okay? And so when we see children who are very ill, and you start asking the mothers, what, this child have been sick for 1 week, 2 weeks, what have you been looking at? Oh, they told me it is teething, and I've been given teething mixture. A lot of babies have died that way because mothers do not come to the hospital on time because they assume wrongly that it's teething. And I always tell mothers, never ever make a diagnosis of teething in any sick child. If a child is having fever, give paracetamol. If the fever is not going, you bring the child to the hospital. The child is having diarrhea, you give ORS, oral zinc. The child is not better, you bring to the hospital. Don't attribute any of those symptoms. Fever, cough, rashes, diarrhea, never attribute them to teething. Teething does not cause any of those symptoms, okay? And do not give your children all those causes in mixture. What are their names? Pecan. I can't remember the names now. Even all this, even the native one, Bomoro, all those other things, Bona Babe, and all that. Do not give your children those teething mixture. Now, finally, for those of us in Africa, sometimes these companies that make this teething mixture, some of them are cutting corners. And sometimes those products get contaminated. If you are very familiar, you can Google it. There's what we call the My Pikin saga that happened in Nigeria. I think it should be over 10 years ago now. My Pikin is a teething mixture brand that was being sold. And a lot of babies were given this My Pikin. They ended up having renal failure because that My Pikin teething mixture was contaminated with methanol. It is a product that should not have been in that product, but when they were mixing it, they contaminated. And a lot of mothers who were giving their baby so-called teething mixture, we ended up losing a lot of children. A lot of children have to be dialyzed. I was in Lutz that period, and I remember we struggling to dialyze these children. We have to send some to UCH. A lot of babies in Nigeria were affected, ending up in renal failure. All these children will never have even have any issues, if not because their mothers want to give them so-called teething powder or teething mixture, and end up even giving them something that is already contaminated. And I don't even know how many we lost. It's something you can Google. Just Google My Pikin. That company has to be banned. That product has to be banned forever in Nigeria. So please, there is no basis for you to abuse a teething mixture in the first instance. It is not necessary. Teething is normal. Your babies will have their teeth and it won't cause them any illness whatsoever. And if they have any illness, you should take them to the hospital and not assume it is teething. So, Pierre, I'm happy you're asking this question because it's one of those questions mothers ask a lot, and it's some one of those things we've always preached against. Do not give any teething powder, teething mixtures. I always see mothers that will start giving their babies this so-called teething mixture from day one till I don't know 1 year. Guess what? Like I told you, most of those teething mixture have paracetamol. Even if it is not contaminated with methanol that will cause renal failure and lead to death, paracetamol on its own can damage the liver of your babies. I hope you know that there is no safe drug. What makes a drug safe is the quantity you give. If you give too much of a particular drug, you can actually cause harm. That is why when we give you medication, we tell you take this quantity, use it for so many days and stop. When we don't want you to use some medication forever. It's as simple as paracetamol is, as simple as it is, as something you can just buy on your own without a prescription. It can cause liver damage if you give too much. So all you mothers that from day one you have your baby, you'll be giving them paracetamol. The babies are not having pains. They are not having body pains. There's no work they're doing that is making them to have pains. So you don't need to be loading them with paracetamol or any TT mixture, because that is what is inside some of those TT mixture and the Phenergan and all those other like Piriton kind of family of drugs. Okay. So when you start giving your children all those things, you are already damaging their liver. That is what is happening. And sometimes children are very ill. We don't know what has happened. Some of these things are as a result of some of these practices. We've talked about dangerous child practices before. I think I will still talk about them. One of the most dangerous one that lots of mothers do, especially in Africa, in Nigeria especially, is that sitting thing. Children do not need you to give them any drugs whatsoever from day one. Breast milk only. They don't need even your so-called multivitamins. If you eat well and you have all the multivitamins in you, you are going to pass it to them via breast milk. Okay, so they don't need teaching mixture. So there is no routine drugs. A lot of mothers ask us about what are those drugs you need to be giving your babies. You don't need to give them any drug. You just need to feed them, keep them clean, take your vaccines, and that's it. All right. So I didn't really go so long on teaching issue because it's something people ask a lot about, and I think we will try and post it as well. All right. I hope Instagram people have not asked questions and I've mixed them. So if you've asked questions on Instagram, feel free to repost your question because your own questions scroll past. All right. Shukurat is asking, how do you treat Apollo in 3 months old baby? Okay. Thank you for the question. Apollo, for those who may not know, is a local language for red eyes. Okay. So people call red eyes Apollo. It's not really correct word for it. We call it conjunctivitis. Okay. It can be due to viruses, it can be due to bacteria. Most of the ones that cause the discharge, like yellowish discharge, itching, and very red eyes, most of them are due to what we call bacteria conjunctivitis, an infection of the covering of the eyes that we call the conjunctiva. So usually most of the time the children will need antibiotic eye drops. Now, antibiotic eye drops are antibiotics. They have to be prescribed by a doctor. Okay, don't go to the pharmacy and go and ask them to give you eye drop. No, because there are drugs we don't give to 3 months old. There's a eye drop that will not give to 3 months old, and all that. For example, a very common drug that most mothers use indiscriminately is chloramphenicol. That drug can be very dangerous, even as an eye drop. So we really need to be careful. So if your baby has a red eye, the right thing to do is to go to the hospital, see a doctor. It doesn't have to be a pediatrician. Any doctor can treat red eyes, and they can prescribe appropriate antibiotic eye drop. In the interim, you need to make sure you clean the eyes properly. Usually we will say plain water and just plain water and cotton wool. You can use it to clean the eyes, and then you discard it and you wash your hands. And then when you're applying eye drops to the baby's eyes, make sure that the tip of the dropper, it does not enter into the eyes, because if you do, you can actually infect the eye drop container itself. And when you infect the eye drop container itself, you are just going to keep reinfecting the baby. So when you are dropping the eye drop, make sure there's a little bit of a gap. Maybe later I will tell the pharmacist to do a little video and show you how to apply eye drops. But that child needs to see a pediatrician or a doctor who can prescribe appropriate eye drop. And make sure that children don't keep putting their hands in their eyes. Make sure you wash their hands. And if for the young babies, you can put mints in their hands so they don't keep putting it in their eyes. I hope that is helpful. All right, I have so many questions today. I hope I'll get to talking about my immunization. Ifeoma, good evening. All right, nice to have you here again. Thank you for joining us. Your 2-year-old 10-month just started all of a sudden to be rejecting eggs, no matter how it is prepared. Is it an issue? Some children just don't like eggs. It's not like it's an issue, but egg is one of the most balanced protein that we have. So we usually like children eating eggs, but some children actually have egg allergy as well, and some children don't just like it. So it's not an issue if the child does not want to eat egg, as long as the child is eating alternative source of protein. that will, give the child the right protein. Egg is actually one of those one that has all we call the essential amino acids. These essential amino acids are very important, building, and the egg has all of them. So when the child eats egg, it's actually that egg white. It contains all the protein that the baby needs. So it's a very good one. But if your baby doesn't have it, um, it doesn't want it, yeah, just make sure you give them other alternative sources, your chicken, your meat, your crayfish, your salmon, all the fish. So there are other ways of getting the protein, as long as the child is getting other sources, it's fine. You don't need to worry. What can cause the sudden hate of eggs? I really, we can't answer that. I don't know. So it's just a personal thing. Some people just don't like some things. It doesn't have to have a reason. I don't know. Maybe some people don't like the smell. Like my husband was telling me yesterday, he also doesn't like the smell of boiled eggs. Some people just don't like it. It's just one of those things. It's not. It's a personal thing. We can't really explain why. But if you have a way of hiding egg in other food, like if you make pancakes, for example, if your child likes pancake, you can still give the child pancake egg through pancake. And I hope ice cream is not the best, but it's also made from egg. So there are still other ways of the child taking eggs in an eating format that the child will not know. So you may also want to consider those options rather than the one where the child can actually physically see the eggs. All right. Tessie Habasuyi. Good evening, Doc. What do you do when your 1-year-old baby's body, most especially the head, gets hot and the baby is very active? The thermometer reading is less than 37.5. You don't need to do anything. Okay, if the thermometer is reading less than 37.5, it means that child does not have any fever, and you don't need to do anything. Just let the child be. I mean, why do you want to stress yourself and look for what is not lost? So that you don't need to do anything. There's nothing wrong with the child. That is what it means. Okay, I've always told mothers a lot of the time we feel babies, and sometimes even if you are warm and you feel your child's head, you will think they are warm. Number two, the head itself is usually warmer than the rest of the body, because actually when the children has just eating or they are doing something, the brain is working a lot. So the head feel warmer because there's a lot of blood going to the head. It doesn't mean there's anything wrong. As long as the temperature is within normal limits, you don't need to do anything. Just let the baby be. You don't need to keep checking their head all the time. And so if the child is not feeling temperature on a objective instrument like a thermometer is normal, then there's no need for you to do anything. Just let the child be. All right. Bukola is saying, good evening, Doc. My daughter collects Mrs. Vaccine on Friday. Good. And she has been having fever. I'm just checking Instagram to make sure I've not missed the question. What's the fever? What's the temperature? So anytime you tell me your child has fever, the next question I want to ask is, what is the temperature? So get a thermometer and measure it. Every mother must have a thermometer at home, minimum. There are some things you should always have at home. Your thermometer is one of them. Your paracetamol, whether syrup or tablets, and of course your ORS or resting. There are some things you always have. Even if you don't have the regular first aid box, you can make one for yourself, and those are the kind of things. So you can just put it in some part of your fridge. Just always have some things like that handy. If you have children, especially children under the age of 5, you should always have those things at home. So I really need to know the temperature. But for your 2-year-old, you can give paracetamol. Most vaccines will give fever. It is not a problem. We expect that. And so it is okay to give paracetamol. I know there was a misinformation that circulated on social media, which is what, when I was addressing the issue of misinformation on social media and content creator, it's a big deal. I think there was a time people were circulating information that if you give paracetamol after fever to your children after they've taken vaccine, that the paracetamol is going to spoil the work of the vaccine. That is absolute nonsense. It is not true. Okay. And so it is okay to give paracetamol after your child has taken vaccine if they have fever. You can see I'm stressing those clauses. Okay. Every clause has the reason why I'm stressing it. Number one, if your child has took vaccine, it is not compulsory that they must have a fever. They may not have fever. and it does not mean the vaccine did not work, because some mothers have also asked that, oh, my baby took vaccine today and didn't have any fever, does it mean that the vaccine did not work? That is not true. You don't always need to have all the side effects. So some children will take their vaccines, never have fever, and that is perfectly all right. Okay. Number two, some children may have fever. Again, that is also okay. It is a side effect of most of the vaccine. Fever and pain around the injection site, these are the most common side effects of immunization. So if your child now has fever, give paracetamol. And sometimes they may have it for up to 2 days. You can give the paracetamol every 6 hours. I think a lot of mothers will just give it once, and that, no, you should give it every 6 hours if the fever is still ongoing, and make sure you are giving the right dose. Because another thing that some people will give paracetamol, they don't give the right dose. I see a lot of mothers asking questions about their 10 weeks old baby, their 14 weeks old baby, and they're asking me, how many drops of Panda, the paracetamol drops, should they give? You shouldn't be giving drops to a 2-3 month old baby. Drops is for newborns. That first 1 month of life, that is when we give drops. After your baby is no longer a newborn, you should give paracetamol syrup. And you should always, before you leave the health center or the immunization center, always ask them, what amount of paracetamol should you give if your baby has fever? Because a lot of mothers come to ATP to ask us, and they, sometimes we don't always answer questions straight away, because most of our moderators are they are volunteers, so we only answer your question sometimes for 24 hours or 40 hours. So it is something urgent. So please, when you go for immunization, always ask the dose to give, because it's based on the weight of the child. But even if you don't know the weight, there's always a guide on, based on the age of the child, on the paracetamol pack. You will say from this age to this age, give 5 mils. From this age to this age, give 2.5. So you can also use that. But the most accurate or best way is to check the dose for the child's weight, because a child may be 2 and be bigger than a child who is maybe 3, for example. So weight is better than just the age. So for your baby who is 13 kilos, you should give paracetamol 13 times 15. That is the dose that you should be giving, 50 milligrams per kilos. So, and most of those paracetamol has a 120 milligram in 5 mils. So let me just calculate how much you give your baby. So 195. So let's see. So your baby will need about 6.6. Just give like around 7 mils of the paracetamol. That is what your baby's, based on the weight, would take. If you have given 5 mils, still okay, but the most appropriate dose will be 6.625. So we can approximate that to 7 mils. Okay. All right. And sometimes some children keep on having fever. After 2 days, if you keep on having fever, you have to take them to the hospital, because sometimes the child is already incubating something before you go for immunization. So the child is already going to be sick, but the immunization happens. So you would think it's the immunization that is causing the fever. In other words, even if you didn't take immunization, that child could also have had fever. So it's a coincidence. So if the child, so usually if it is fever from immunization, within 2 days, it should be down. So if it is not down in 2 days, then we should assume there's something else going on. So you bring the child to us. Actually, or if the fever is very high, like you are reaching 39, 40, most likely it's not immunization causing that. That child could be sick from other reasons. And for that, you need to bring the child to see us at the hospital. All right, so we have people already asking questions on immunization, so I will start to address immunization while I'm still here. Pearl is saying your baby is 3 months, 1 week. She hasn't had taken Rota 1 and 2. Next week Tuesday she's meant to take Rota 3. Yeah, it's not available. Sorry about that. I know a lot of people have been asking the Rota. It's not been available. It's really a shame, really, but just try again, see whether they will have Rota. But while I'm still on that Rota question, because a lot of mothers are always worried about Rota 1, Rota 2, Rota 3, let me just clarify that Rota 1, Rota 2, Rota 3 is the same vaccine. They are not different. It's the same rotavirus vaccine. There's only one rotavirus vaccine. But when we put 1, 2, and 3, we are only putting those figures to specify the number of doses that the child will take, or the one that the child has taken. So if your child, so the first time your baby has rota, we call it rota 1. So that when baby now take the second dose, we'll call that rota 2. When your baby now take the third dose, we call that rota 3. But it's the same vaccine. Now, a lot of mothers will be panicking like, oh, my baby is taking rota 3. When am I going to take rota 2? So when your baby take first dose of rota, whether baby take is given at 10 weeks or 14 weeks, like in your case now, you're only just going for the 14 weeks. So what you are going to go for now, even if they give, if let's just hope and pray that the vaccine is now available, it's actually rota 1, because that's the first time you'll be taking rota. It is not rota 3. At that 14 weeks and first time you'll be taking rota, that is still rota 1. It means your baby has only taken 1 dose of rota vaccine. So when you now go, the next dose must be 4 weeks again. Your baby will now, that will not be rota 2. Let's say you now go at 18 weeks, that will not be rota 2. And then if you now go for the third one at 22 weeks, that will not be rota 3. Okay, I hope that is clear, because a lot of people always get that confused. The same thing when we say penta 1, penta 2, penta 3, it's still the same vaccine. There's no difference in the vaccine. The 1 and 2 and the 3 suffix are just to let you know how many doses of that particular same vaccine we have given to your child. So rota is a good vaccine. It protects our children against rotavirus infection. Rotavirus infection is the commonest cause of diarrhea in children. Even if you are doing all the hygiene and all that, rotavirus can still happen. So that's why children will have vomiting and diarrhea. And it tends to peak between the ages of 6 to 11 months. So ideally, we want all our children immunized with rota by the 14 weeks. So unfortunately, if we're having vaccine shortages and all that, it means the children may not end up getting the rota. And most of the manufacturer of rota vaccine will say if you don't take the first dose by that 15 weeks, there's really no point. Because I understand why they said that, because by the time you are taking it, the child is already at risk of having rota, so the vaccine may not do much. But some pediatrician will still say, as long as baby is under 1 year, we will give it to you. So different opinion on that. So, but if you can still get it, just get it. Unfortunately, we have no control over these things. And if you have the funds, you can pay for it and buy it. I'm sure some is available in private hospitals where you can buy. But if you want to wait for the government home, we just have to pray and hope it's available. Ask in other health center, maybe even outside your state, if they have it, you can go for it there if you don't mind. Or better see if you can pay for your home copy. That'll be best. I understand. I apologize to you on behalf of the Nigerian government and the Nigerian pediatricians. This should not be happening, but unfortunately, vaccines are expensive, and the government has to budget for these things, and it has to be paid for. Even though you are getting it for free, the government is paying for them. That's why we should actually value and take these immunizations. All right, if I might say, I would like to know if milk and fruits can hinder the effectiveness of malaria and antibiotics in children. Yeah, there are some food that can affect some drugs. That is why when you want to give your children drugs, you should speak to the pharmacist. I know it's a culture that is fast dying because we have very few pharmacists, but ideally when drugs are prescribed, the pharmacist is supposed to dispense the drugs to the mother. And it's not just for them to give your drugs and write on it 111 or 555. No, there is more to giving drugs than that. The pharmacist is supposed to counsel you. So that is why the pharmacist will tell you, this one you take it before food. This one you take it after food. This one, don't take it with milk or tea. This one you have to take it with milk or take it with food. For example, we are giving you ibuprofen. Ibuprofen must never be taken on empty tummy. You must always take ibuprofen after food. Whereas you can give paracetamol before or after food, it doesn't really matter. Which is why when children have fever, most of the time, because we are never sure whether those children are eating or not, I always tell mother give paracetamol. Because if you have to give ibuprofen, you have to make sure that child eats first before you can give ibuprofen. So there are some anti-malaria, especially I think that testing, you should not be giving it with vitamin C. So that is what it means. It doesn't mean that the child cannot take the fruit after or even before, but it should not go together, because the metabolic processes that happen on how those drugs are absorbed can be affected by things like vitamin C, can be affected by things like milk. So different drugs have different advice around that. And this is also why it's important for you to read the leaflet as well, because the leaflet will also write those kind of information in them as well. They will tell you what you should not do as well. But it's also the pharmacist's responsibility to tell you that it's not a generic coating like all anti-malaria don't do this, all antibiotics don't do this. They are very specific. So there are specific information, for example, the ACT anti-malaria, different from maybe Fancida and all that. So whenever you buy those drugs, always ask the pharmacist to tell you, and they should ideally tell you. And second best, read the leaflet as well. And so the leaflet will clearly specify what you should do, what you should not do. And like I was saying, one of the short videos we released, even for pregnant mothers and breastfeeding mothers, there are also some drugs you don't even take as well. So there are lots of issues around drugs, which is why, number one, you will never see us just telling you to go and take this drug. So a lot of people ask us questions and they wonder why I cannot just sell, like I think Shukra just asked, can I, how do we treat Apollo in a child? I cannot just tell her go and use this particular drug. There are lots of responsibilities that go into drugs. Number one, you have to actually have a consultation. What if a child is allergic to penicillin? What if a child is allergic? How do you know that? These are the kind of questions doctors ask before they prescribe medication. But you see mother just said, oh, go and use that drug. They don't know whether this person is allergic to that particular drug. There are people that are allergic to sulfur. They should not take fancy that. They should not take some maybe Subtrin, for example. Those are weighted responsibility. People can take drugs and die from it. That is the truth, because they react to it. So we don't just prescribe drugs anyhow. Then we need to work out what is the appropriate dose for this person. Okay, and then we need to work out or give you all this counseling about how long you should use it for, what to avoid, what not to. Those are all the issues that go around drugs. That is why you see us on our group. We don't prescribe drugs like that, because all those things that go along with medication, we can't do it on that kind of a platform. So whenever you are going to buy drugs, which again is why we should not be just walking into a pharmacy and buying antibiotics anyhow. We should let it be prescribed by a doctor. There are drugs you can buy over the counter, your paracetamol, your deworming and all that, but there are many drugs that ideally should be prescribed. Okay, and antibiotic is definitely one of them. All right, I don't seem to have any question on Instagram today, which is okay. Hope Homiche, maybe he will be 8 months next week. He will only suck 3 times a day. He's constipated. After all the struggle, he will pull small. You should be eating complementary food, because your baby should be eating more than just sucking 3 times a day. So I really want to have that information. So your baby should be having other food, complementary food. Your baby should be having fruits, should be having vegetables. Your baby should be drinking lots of water, because this child is constipated and there are more going on. And what is the weight of the child as well? Because sucking 3 times a day is not even my worry. Is the total amount of other food that goes in for this child. So we need to make sure we need to get all the full information. So number one, what other food is your child eating and how many times, and what are the content of those food? Are you adding fruits? Are you adding vegetables? Are you giving the child water to drink? Okay, and because that is what will affect why the child is having constipation as well. And then what is the weight? Is the child gaining weight or losing weight, or the weight is not what it should be? So if you can provide that information, I can still give you some advice. But alternatively, you may want to see a doctor so that they can actually have deeper conversation with you, just to make sure you are doing the right thing. Okay, but if you need more information on feeding, if you go to our Facebook group, we have a guide session that talks about complementary feeding in children. Okay, Bukola, you were the one that asked about the temperature of your baby that after having measles. 39 is actually quite high. 39 is high. I would really say you should go to the hospital. Most of the time, fever from immunization, they usually tend to be low grade fever, not very high. 39 sounds very high to me. And then I think you said your baby had the vaccine. When was it? On Friday, and today is Monday, so it's already past my 2 days deadline. So if your child is having fever on a Monday and it is 39, I don't think it has to do with that measles vaccine. I think this child is ill, and I think that child needs to go to the hospital now. So please give the paracetamol. I've already told you 6.67 mils. So give 7 mils of paracetamol now. Syrup, and then you take that child to the hospital. There's something else going on. It is just a coincidence. That happens a lot sometimes. Children who are about to be sick, they are still incubating something, then they go for immunization, and then they actually now become ill. And naturally we assume it's immunization. Sometimes it's not immunization. That one is just a coincidence. So the how high the temperature is, how persistent it is, those are the clues. So immunization fever, within 2 days it should be gone, and it usually shouldn't be reaching 39. So 39 is really quite high. So I really want your child to see one of us in the hospital. All right, Henrietta, nice to have you here, ma. Thank you. Thank you for joining me. What is normal body temperature for babies in months? It doesn't matter whether babies, children, adults, the temperature is the same for everybody. It's 36.5 to 37.5. I will usually take 37.5 as my cutoff. Some people will say 37.4, So, but that we don't want it to be above 37.5. So that's the normal body temperature. It's the same for everybody, even adults, really, even children. So it's the same temperature. We always want your temperature below 37.5, but we don't want it also too low. We don't want it below 36, because that will now be becoming hypothermia, low body temperature. So we want the children to be normal body temperature, 36.5, 37.5. That's fine. And so when you use your digital thermometer, you can know which one. Okay, hope your baby is eating 2 times a day. 7.1. What was the birth weight? Sorry, I didn't ask you the birth weight. 7.1 for an 8-month-old baby is a little bit on the low side. An average 8-month-old should be weighing 8 plus 9 divided by 2. It should be weighing at least 8.5. So this child is a little bit underweight. Though he didn't tell us the birth weight, unless your baby was a preterm baby and was low at birth. So we always need to have the background so we don't judge. But if your baby was born at term weighing at least 2.5, the baby's weight should be closer to 8.5 now. So I'm a little bit concerned about that. Okay. You may want to see either a doctor or a dietitian, so that we can walk through the quantity, the frequency. We can walk through all those things. So the baby is constipated. There's something else going on. Even though your baby is eating apple, so that the child is not getting enough water. Vegetables also is important. So you should ensure you give all that. But more importantly, I'm also worried about the weight of the child. You can give any fruit. You say, I can see your question that can you give watermelon? You can give any fruit as long as it is something the child for a watermelon, for example, you have to remove all the seeds. So some of them you have to blend them into like purees, for an 8-month-old, so that they don't choke on it. That's the key word. For example, your apple now, I hope you're puring it, because an 8-month-old cannot really chew a proper apple, so it has to be pureed. But things like banana, most babies can, they can munch on that, and it is soft, and it won't give them any problem. But also make sure your child is drinking water. The breastfeeding should just be, you don't need to number how many times your child breastfeed. They should be breastfeeding continuously. It's still the same way you were breastfeeding when they were on exclusive breastfeeding. You are now just adding the food to it. So, but I really think you may need more of a one-to-one session with either a pediatrician, a doctor, or a dietitian. Those are the people that you need to have that conversation with. In this part of the world, can we test for allergies? Yes, of course. There are doctors who do allergy work. In most of them are in the teaching hospitals. So if you go to a teaching hospital, ask them whether they have an allergy clinic. And I think some of them do run those allergy tests. They are not obviously all over the place. They may not be that many, but they are definitely available. I know a couple of them. uh your knees keep having recurring painful boils. That doesn't necessarily mean it's allergic. Boils and allergy don't really seem to rhyme to me. So recurrent infection may be something else. So for that one, you should actually go and see a dermatologist. That's the skin specialist, not necessarily allergy doctor. Unless there's something you notice that it's only when she takes this particular food or she takes this particular item, then she comes with those boils, which is very unlikely. Most people that have allergic reaction, they have what we call purpura. Like they have what we like a wheal, something like a raised lesion, red, raised, itchy, but not boils, because I'm just using your word. I'm just using exactly what you wrote. So I know sometimes people call things different things, not necessarily what that thing is. So for allergy, we expect it to be like a wheal, like a raised part of the skin that look like orange peel, and then have redness. Sometimes it could be itchy. That is what we see with allergies. Boil is actually a skin infection. So if your child is having recurrent skin infection, or your niece, sorry, that's maybe something different. There may be a reason why she's prone to having recurrent infection, which will have to do with immune system and all that. So I'm not quite sure it's the same thing. Okay, she has been to different pediatric hospital. So what did they tell you? So people always say, oh, I've been to hospital. It's not enough for you to tell me you've been to hospital. I want to know what the pediatrician said in those hospitals, because that is actually more relevant. Okay, it is not just that the child has been to the hospital. It's not going to the hospital or seeing somebody that actually matters. It is, who did the child see, or who saw the child in the hospital? What did they tell you is wrong? What did they ask you to do in terms of tests? What medication did they give? So doctors, we are not we are not oracles. So there are principles of medicine. One of the things that when you come to us, if you look at the symptom, we suspect. We always suspect. Sometimes we have to confirm by doing tests and all that, and then we treat based on either what we confirm or what we suspect. So sometimes if we treat what we suspected as number one, and the child doesn't get better, then it means that we didn't get it correctly, and sometimes we have to go down to number two, because there is what we call differential diagnosis. So sometimes when you come to us, say you have fever can be due to malaria, it can be due to chest infection, it can be due to throat infection, urinary tract infection, and all that. So then we ask so many questions. It will help us to narrow down, out of these 100 or 1,000 causes of fever, okay, maybe malaria is the most likely. Then how do I know? I go and do a blood test. I do malaria. I also do full blood count, because I want to check whether there's also infection. So let's say the result come out, the full blood count is fine. There's no raised white blood cells. It's only malaria that is positive. Then I'm more convinced, okay, I think it's more likely malaria. Then I go ahead and treat malaria. That is how doctors work. So at the beginning, sometimes we are not 100% sure what it is. Our tests sometimes help us a little bit, but sometimes there are some conditions you don't have those kind of tests to help you. So for those kind of conditions, we do what we call, you treat the most likely cause of that symptom. So, and we'll review it again. So that is why we always give you follow-up appointments, so that when you come back, if the child is getting better, and then that means we got it right. But if the child is not better, then we have to think, is there something else? Is because there are some things that look alike each other. So we start thinking of what we call our differentials, and then we'll start sorting through it again. Which is why it's important that you don't just keep jumping from one hospital to another, because if you jump to the next hospital, instead of going back for follow-up with the first doctor, that second doctor will also start all over again, repeat almost the same thing maybe the first doctor did, and then you're not going to get the right result. Then you see jump to another one again. That is not the right thing. Make sure, number one, you see the specialist in the first instance. Make sure you go back to them for follow-up. That way you will be sure you're getting the right that's the right approach, really. Unless you don't have confidence in that doctor, then, which I always say, always make sure you go to the doctors that you have confidence in. Okay. All right. Okay. Oh, Pomije, your baby is 2.5 kilos at bar. Yeah, your baby should be weighing at least closer to 8.5 now. So I really want you to see someone and there's small going on. All right. Okay. One more question. Happier. When my baby vomit, it doesn't come out like normal water vomit. There's nothing like any normal vomit. Vomiters can be different kind of a color, different kind of. It depends on at what point the child vomited. So there's nothing normal about vomiters, and we don't expect it to be the same. In fact, when you come to us and you tell us your child is vomiting, we always ask certain questions, and one of the things we always ask is that what does the vomiters look like? What is the color? Does it contain blood? Is it greenish? Is it containing blood? Is it having this? Is it having that? Is it the food that the baby just ate? Or is it watery? So the information you gave us actually help us to narrow down what could be the problem. So there is no, I'm just trying to tell you that there's nothing like normal water vomits. There's nothing normal about any vomits, and they can be different. And the different kind of vomiters will also tell us different kind of information. So I think that is just your own assumption that okay, this is how a vomiter should look like. There's something like that. They can all be different, and depending on how it looks, it can give us some clues as to what is causing the problem. For example, if a child is vomiting what looks greenish, okay, we start suspecting what we call intestinal obstruction. That means something is blocking somewhere along the intestine. If somebody is vomiting blood, there are things we start thinking about. Okay, so there are different things children can vomit, really. All right. The most important is that the child should not be vomiting, sha. That is more important. So if your child is vomiting a lot, I will worry about that. And I don't know whether that's your 3-month-old baby, because you say your baby vomit. You didn't tell us the age, but you've asked a question before about your 3 months old. So your 3 months old should not be vomiting at all. And also make sure you differentiate vomiting from reflux. So babies, because you have a small baby, they can have what we call reflux, in which where they bring back a little bit of the milk that they've sucked, and the baby is fine, baby is playing, but just a little bit of the, what do you call it? I'm trying to remember the common everyday language for it. Spit up ahead. The spit up that babies bring out, that is what we get in reflux. That is normal. As long as the baby is gaining weight, we're not, that is not vomiting. Vomiting is usually very active. You can see the child made an effort to bring out that. It could be milk, it could be water, it could be blood, it could be green stuff. So many things can come out when children vomit, and the child is really not well, the child is sick, and it can happen many times. So if a child is vomiting, you need to see a pediatrician, you need to see a doctor. But if it's just reflux and a little bit of spit ups, that one just clean it and you don't have to worry about it. So I'm not quite sure which one your baby is having, so I can't really comment on it because it sounds like a commentary rather than a question. And you say your baby sneezes too much. What is your definition of too much? How many times is baby sneezing? And then what do you also apply to the baby? Some of us learn to use this eucalyptus oil and we're putting it in the baby's cream, you're putting it in your baby's head all the time. It makes the baby to sneeze a lot. So if you are the part people that use silver bed oil, eucalyptus oil, you can stop it. You don't need to start giving your baby. And make sure the room is well ventilated. Make sure there's nothing irritating the child's nostrils. So those are the things you also need to do first. Because sneezing just means something is irritating the child's nostrils and airway, and the child is just getting rid of it. So we are more interested in what is actually triggering it rather than the sneezing itself. There's nothing wrong with the sneezing. You should focus more on why is the child sneezing, what is triggering it. And from my experience as a pediatrician, the number one, actually for Nigerian mothers, it is that silver bed or you people are always putting on your baby's head or using in your room. Or sometimes all these, even your perfumes that you use for yourself, sometimes they irritate the babies and all that. So just try and figure out what it is. Or some of us are cooking, or the fumes of our you're cooking in the kitchen and taking the baby there, the palm oil fumes, all those smoke fumes, or your generator fumes. Those are the things that can irritate babies and make them to sneeze a lot. Even so, some of us use very strong perfumes or creams that smell so strongly. Those things can irritate babies. So if you're a mom, a nursing mom, you need to actually do away with some of those smells and stuff a lot. So I hope that's helpful. All right. Wow. I didn't get to talk about my immunization today, and time has gone. Udrak, good evening, man. The rashes that come out of children on the face to the head there's no rash that should come out on children's face to the head. The way you wrote that post, you make it sound like it's normal for children to have rashes. There's no normal rash in children. So you have to describe specifically what rash your baby is having. So we have a context, but there's no rash that comes out of children. There are many different kind of rashes that children can have, and none of them is not something that we should expect as routine rash. We don't expect any rash to be routine for all children to have. Even the ones that we say you don't have to do anything about it, that doesn't mean it's routine. I don't know whether you get my point, but the way you wrote the question is it's like you are assuming that I should know the kind of rash you are talking about, but I have no clue at all, because there's no rash that I just expect to come out on face and the neck to children. But I'm happy that you've seen your doctors, and if it is not going after you see your doctors and your doctor has treated, you have to go back to the doctor, because like I always say, for rashes, the most important thing for rashes is to know what is causing the rash. Two most important questions we need to ask about rashes: what kind of a rash is this? What kind of a rash? We have different kind of rashes. We have what we call the macular rashes, the one that you will see but you can't feel it. But we also have what we call papular rashes. You can see it and you can feel something on top of the skin. We have what look like cystic rashes, like something, or vesicular rashes that have like there's water on the inside. You have some that have look like there's pus on the inside. So we have different kind of rashes. Okay, there's some that look red and itchy and all that. So there are different kind of rashes. So we first talk about what kind of a rash it is. Then the second question we want to answer is, what is causing the rash? Okay, so for example, newborn babies, they have these tiny white dots all over their faces when they are newly born. We call it male, and that is it's a rash. We don't need to do something about it. Some of them have what look like itch rash. Itch rash is also one of the rashes. Itch rashes. Most of the time we don't need to do anything about it. You can have rashes due to allergy. A child is reacting to something, it's reacting to the formula, it's reacting to a milk or the egg, and the child starts to have rashes. Allergic rashes, most of them tend to look like wheals or papular rash. We have rashes that are due to infection, and we have all kind of infections. So we have the virus, like you have in measles, you have in rubella, you have in mumps, you have the bacterial infection as well that look like what we call impetigo. You have your chicken pox that is still under viruses. You also have fungal rashes like what we call tinea, ringworm, and that's the layman word I was looking for. So we have all those kind of rashes. So we need to see rashes, number one, to know what is type of rash it is. Then number two, we need to ask all these kind of questions to know which of all these possible causes of rashes is the cause in your baby, and that is actually what determines the treatment. Okay, so I'm not sure so usually when your doctors are treating your child for rashes, you should ask them those two questions as well. Like, or maybe you don't need the first one, but at least you need the second one, like what is causing this rash. From what you have said now, your doctor treated your child with antibiotics, so that means your doctor assumed that rash is due to a bacterial infection. But if it's not going, then your doctor may actually be wrong. So in other words, the rashes may actually not be due to an infection, and that is why the rashes are not going. So the right thing to do is to go back to your doctor and say, doctor, I've used the treatment and it's not going. So that the antibiotics is not working for that rash, or you are not even dealing with something that is a bacterial infection, in which case antibiotic is not the treatment. And if you are not comfortable with your doctor's ability to manage rashes, the best doctor to see for rashes is the dermatologist. That is the skin specialists. So they will know better. They will know all kind of rashes. Even me as a pediatrician, if I suspect a rash, I treat it, I'm not getting anywhere, then I'm going to send the child to the dermatologist. That's their specialty. They are the experts in the area. So I can't guess what your child, because number one, I've not seen these rashes. You have not even given me a lot of clues. You just see this rash. You didn't tell me whether the rash is looking like this, it's red, it's itchy, is this, you've not told me any information that will even give me a clue. But even if you tell me all that, I still need to see the rash so that I can, number one, know what kind of rash it is. Then I can now ask you more questions to suspect the cause. And so I can't assume whether it's the weather, I can't assume whether it's the infection. It's difficult to do those assumptions without seeing that child and seeing the rashes face to face. So the best thing to see, and based on that, I can't give you any remedy as well, because that is what you're asking me. I have not seen the rash. I don't know what is causing the rash. I cannot say this is the treatment when I don't even know what the rash is or what is causing the rash. I took my time to explain all this because people do this all the time, and also to advise that don't take people's advice for rashes, because they may be wrong. And sometimes the treatment of rash can make things worse instead of getting better. So either you go back to your doctor or you see the skin specialist, that's the dermatologist. That's just the advice I would give. Time is up, but let me answer the last question. Eki said they just give antibiotics, run tests without telling us the name of the test. So next time we will ask for the name. Yes. Okay, yes, I remember. Okay, yes. So they should, it is your right to know. I always educate parents and family on things you should know. So it is our responsibility as doctors to tell you what is wrong with your child, to explain why we're doing this test, to tell you what drugs we're giving. We should not just be writing drugs, writing tests, and not talking to you. It is wrong. The same way I'm answering questions here and I'm telling you the way I'm thinking and how we're working, your doctor has a responsibility to do the same and to tell you everything. They may not be right, but they should be able to tell you that. They should be able to say, this is my suspicion. I'm not yet sure. No, that is how we do. There's no law that say we have to know everything from day one. We are not oracles. We don't divine. We only do what we call consultation, and then we have our differentials and we try which one works, and that's how medicine is. So make sure you also ask questions when you go for your consultation. Ask questions. When you ask questions, your doctor will also give you more information. But it is your it's your right to ask, and it's our responsibility to talk and to give you, at least break down that information for you to understand. All right, so I'm happy you're going to do that next time. PL, if you go to our Facebook group, just ask this question that you can't find the guide, but make sure you're using the full Facebook app. The full Facebook app, you will see the menu, and the guide is one of the menus. So, or if you post this on our group, somebody will give you the answer. It's a very straightforward place to find the drugs. This drugs I was asking about rashes. Yeah, okay. Something that look white heads, small boys. Yeah, I suspect that's if it's looking like boys, maybe that's why your doctor think it's bacteria, and that's why he gave you antibiotics. So if it's not working, then maybe it's not actually a boy. But I said better to go back or see a dermatologist. All right, thank you so much, everyone. Today's a long day. But I just want to talk about, I need to clip this, routine immunization versus supplementary immunization. I notice a lot of us are not getting it correctly. And when we posted the rubella, Mrs. Rubella vaccine campaign that is going on right now in Nigeria, I got a loads of questions. I'm happy for those who have finally understood, because I see a lot of questions like, oh, my baby already taken MMR before. Do I still need to take it? My baby has done this. Oh, my baby has done that. And some people are also scared, like, oh, I don't want to take this vaccine, blah, blah, blah. Okay. So I'm just quickly going to answer a few questions on that. That is actually what I want to talk about, but today's questions are so many. Routine immunization is the immunization you bring your child to us, to the health workers, for us to give to the child, and usually follows the immunization card, the immunization schedule of the country. So our immunization schedule in Nigeria may be different from that of Ghana, may be different from that of US, may be different from that of UK, but all countries have what they call their routine immunization schedule, which in other words, that is what we will give to your baby at birth, like BCG, oral polio, hepatitis B. That is what we give to all babies in Nigeria at birth. Then you come to us at 6 weeks, we give Penta 1, Rota 1. We also give pneumococcal vaccine and oral polio 1, OPV 1. That is our, and I think we started giving IPV as well. That is routine immunization. Then you come at 6 weeks, 10 weeks, then you come at 14 weeks, then you come at 9 months. We give measles, we give meningitis vaccine, and we give yellow fever vaccine. Then you come at 15 months, we give measles 2. Okay, then you come to us at 9 years, we give you HPV vaccine. Okay, so those are the routine immunization. Now, apart from this routine immunization, once in a while, we want to deal with certain infection or certain conditions that are coming out as an outbreak. So let's say we know there's going to be an outbreak of measles, there's going to be an outbreak of rubella. We want to, or even polio, we're trying to eradicate polio right now. So sometimes we want to give everybody some vaccines. This is not something you come to us for. We come to you and say, in addition to the routine vaccines your children are taking, we are trying to deal with this particular outbreak, epidemic, or we want to get rid of this particular condition. So we're going to give all the children again. Sometimes we say all children below the age of 5, or all children, like the measles rubella one is up to 14 years. So we give all the children within a particular age group this vaccine again. Now, that is what we call supplementary vaccine. Now, it doesn't matter whether your baby has taken those vaccines before as part of routine or they've never taken them. Everybody is getting it. Is that correct? So that is supplementary vaccine. So the MR vaccine that is being given right now is a supplementary vaccine. It's just the same thing like we do oral polio as well. Sometimes we've also done measles alone in the past. So supplementary vaccine, you should always take them. It doesn't mean that the fact that you've taken the routine form of those vaccines, you don't have to take the supplementary one. The goal for supplementary vaccine is different. The goal is more of a global focus, and it's more for a target response. And sometimes we have to capture every child. We have to capture almost all the children at the same time to break the possibility of an epidemic or to kind of eradicate a particular disease. So supplementary vaccines are extra vaccines that we give to everybody, whether they've taken it before or not, within a particular age group for a particular reason, either to avoid an epidemic or to break an ongoing epidemic or to eradicate a disease. So it is different from your routine immunization. Of course, for every vaccination, we always want your consent. So your schools will tell the children to get your permission before they can give it. But I want to encourage us to always cooperate with the healthcare workers. Give your children these extra vaccines. It doesn't cause them any harm. I know some of you say, oh, I've taken the church, then they've given my child in the school. They've not given 2 doses of it. It is just a waste if at all they give the 2, but it doesn't cause any harm. It's better for your child to take extra than to miss it at all. So please, let's give our children these vaccines. For those of you who, I know there's a lot of misinformation on social media about vaccines, and a lot of mothers are panicking. Let me just reassure you that vaccines are safe. They don't cause any harm to your children. They protect your children against those diseases. Okay, places like US and UK, where before some of these diseases were almost not even happening ever before, but because people have now started saying, oh, I don't want vaccine, they are not having outbreaks of measles in UK, in US. these were countries that were completely free from all these viruses before. And it's all because people were saying, oh, I don't want to take vaccines. And these diseases, when they happen, children can die from them. So let's protect our children against measles, against rubella. The Nigerian government is currently doing the integrated vaccine campaign and giving the measles, rubella, 2 vaccines in one to all children between 9 months and 14 years. They are going to give it in schools, health centers, mosques, churches, even public spaces. Please make sure you take them for your children. If you have any question about them, come and ask us on Ask Pediatricians and we'll clarify all your doubts. But trust us, we can never have to do something that will harm your children. All these things are to protect our children, and these things cost the government a lot of money. So if they are trying to protect our children, the minimum we can do is to make sure our children are available for them. Thank you so much. If you still have any question, feel free to post it on our Facebook group from Mondays to Saturdays, and we will answer them. Have a wonderful evening, and it is bye from me. Bye bye. All right. Major Evans, your question came so late. Time is up, but feel free to post it on our Facebook group. I will answer them. Bye.